Welcome back to Arise News Hour. I'm Charles Aniagolu. Now, as you might have heard on Arise News, a South African government minister has roundly criticised African leaders who seek medical treatment abroad. Aaron Motsoaledi condemned what he called health tourism and said African leaders should concentrate on building the healthcare systems in their own countries. The criticism happened as more than 30 African health ministers were meeting in Zimbabwe to tackle the country's public health problems. President Robert Mugabe, of course, frequently receives treatment in Singapore, and Nigeria's Muhammadu Buhari and Angola's Jose Eduardo dos Santos often seek medical treatment abroad. All this, of course, underscores the fact that African countries face significant healthcare challenges and drastic improvements will be needed going forward. Well, here in the UK, Africans in the global health community, along with those with a passion for Africa, are increasingly seeking to strengthen their ability to help improve healthcare systems across the continent. The Global Health Cafe is one such platform created by the London-based global mental health expert, Dorcas, and the global health policy expert, Ade Adeyemi, and they both join me now in the studio. Thank you very much indeed to both of you for coming in. First of all, starting with you, Dorcas, your reaction to that criticism by the South African government minister against health tourism, as it's called.
Well, Charles, we've got to praise him and give him praise for raising this issue. These are questions that we, as the public, have had for a very long time. Ministers campaign on the ethos that they will actually improve their healthcare system, but they don't access that. Here's a minister at a very high level in Africa raising the issues, and we've got to give him the credit. There are issues here. Why are they not accessing? Even if the private healthcare system, they're not accessing that. If it's not good enough for them, then why is it not good? Why is it good enough for their own population? Absolutely,
that's a very good question. And I'm going to ask you this, Ade. You're a public policy health expert. Why is there such little spending on healthcare in Africa?
Well, there is quite a sizable amount of spending on healthcare across the continent.
Well, in terms of the percentage of what they spend,
percentage from the health ministers is ludicrously small. Absolutely right. I think there's some tension between the facts that a lot of the funding comes from outside sources, from Western governments, from those in the Northern Hemisphere, and that creates some dependency, which perhaps doesn't lead to long-term sustainable solutions. What Dorcas and I see is that perhaps there's more African-led visions of healthcare that needs to be done, which is why we've convened the Global Health Cafe, that addresses that question, that actually how do we move away from this dependency, how do we leverage our communities and talk to our health ministers to make sure that health tourism doesn't happen and we are funding and leading healthcare systems for ourselves.
Well, let's talk about your Global Health Cafe. Just tell us a bit more about what it is. Is it a sort of health talking shop?
It's an exciting platform, Charles, and we're really excited to form this. First of its kind, the global health community is asking us for a very long time, where can we convene? And ask and have discussions about global health issues. And not necessarily people who are clinicians, but everyone who has an interest in Africa. And so Ade and I put together a platform where community...
We're looking at pictures of that platform now,
gets together and has these discussions. And we've had wonderful guests and had fruitful discussions around culture, the impact of Brexit on global health. Very soon we'll be talking about migration and mental health with Agnes Gitau, who you know very well. So it's a platform of enthusiasts, really, or not necessarily, all of whom have an interest in Africa, and the future's bright. We're looking
and it's not just a talking shop. It's a place where we convene and formulate ideas that can shape and
well, talking shops are actually places where you brainstorm, isn't it? But at this stage of the Global Health Cafe, I mean, I have to say it sounds like a very good initiative. You're talking about something that is absolutely critical, which is the heavy burden, health burden that the continent of Africa carries.
Yeah, and there are things within this paradigm, points within this discussion that aren't quite raised. For one, the African diaspora. The Global Health Cafe is largely an African-led initiative, and it thinks about the population of Africans outside of Africa and what their role is, particularly in Britain here. People are African diaspora. They have an imagination and a construction of what healthcare should be in the continent. They are taxpayers as well, and there is a fruitful discussion to be had with governments about how funding is done and how we can have more sustainable long-term solutions. So that's really what we want to press ahead, that sustainable, effective long-term solutions need to be African-led.
But who are you talking to about this? I mean, some of the things that Ade just raised, he talked about talking to governments. Are these African governments that you're aiming to talk to? Because they're all going to say, well, we know what's going on. I mean, we just haven't got the money to do it.
But as a collective, as an African collective, this is the first of its kind. And we're looking to leverage this to innovators and those who influence policies. It's no coincidence, Charles, that Dr. Tedros is the first African.
Yes, I was going to mention that that's the guy who heads the World Health Organization.
Are these small platforms going to be informing his policy, and particularly as the continent carries the heaviest burden? We're hearing of floods in Sierra Leone. Countries are very fragile. Healthcare systems are very fragile. So could this platform be a platform that could inform, perhaps, policymakers and those.
Well, I have to ask you that question. Could it be?
This is what we're looking at.
Right. Absolutely, it could be. Just as other think tanks inform policy, inform decisions at the very highest level. You've got convening platforms, World Economic Forum as an example. This is a convening platform that will shape policy in the future. Absolutely.
I mean, are there any plans though to expand this rather noble quest beyond just sort of meeting and chatting about healthcare? I mean, obviously you're talking about advising big healthcare bodies like the WHO and so on. I mean, would you, for instance, consider intervening directly in Africa?
As the community grows, that is the vision that we have.
Right.
And Charles, if a project comes out of the people who are attending these global health meetups, to us that's a success. If we can move forward and we think perhaps we can have a leverage on bigger platforms, then we're very much looking forward to that. The vision will always be influencing what's happening in the continent. And we are looking to learn from other countries. We're comparing like to our like. What lessons can we learn from middle-income countries? What lessons can we learn from other countries who face other similar challenges and improve their governance systems to improve their healthcare systems?
Of course, Ade, I mean, Africa loses a huge number of its medical staff who leave the continent for better paid jobs overseas. I mean, just go to the National Health Service here in the UK. I mean, and that leaves the healthcare systems in Africa rather damaged. I mean, is that something that you would be addressing?
Yes, absolutely, and it's something that we addressed, or some of our members have addressed in their other lives. For example, there's policy within the National Health Service now that allows people to respond to humanitarian disaster situations. And that came from political groups that met in Parliament. And so similarly, we are aiming to create initiatives and policy ideas that will reduce the impacts, as you've just said. But I think the biggest impact is actually from the imagination of what it means to deliver healthcare in Africa. And helping to stem that flow, or even reverse that and have people imagine their ability to impact healthcare on the continent, diaspora impacting, which is something we do with a fellowship that I run as well.
Sure.
So absolutely, it's certainly within our ideas.
And of course, Dorcas, I mean, a key part of improving healthcare in Africa is the fact that it offers potential business opportunities, isn't it?
Which is absolutely key. What opportunities are we missing by improving our healthcare system? We could actually leverage our own economies so that other people can actually access those healthcare systems. That is a key part that I think we're missing in Africa. The other point, Charles, is that health doesn't exist in its own entity. It's impacted by wider issues. We talk about brain drain and many people migrating. If we can improve security in Africa, people won't migrate. Forced migration always has bad outcomes. So health can't be viewed as its own entity. We've got to look at wider issues that actually support that. But yes, you're right about the economy. countries like South Africa, Nigeria to some extent, leverage their economies based on people who are actually accessing those economies. What can other low-income countries do to actually improve their economies?
Of course, there's also lots of other problems. You know, this lack of available good healthcare leading to fake doctors. I was reading a lot of that out of South Africa, out of Nigeria, dodgy people who take advantage of and endanger people's lives.
That's a problem in healthcare systems across the world, not just Africa.
Indeed.
Right.
Certainly, it seems more heightened in Africa because you're perhaps starting from a lower base. But it's a challenge that, along with infectious diseases, along with how you pay for healthcare, our taxpayers pay for healthcare, is something in Africa. And I think that's why we wanted to start by praising the health minister for talking about this, because these are criticisms that actually many healthcare systems face.
Sure. So what's your next global health cafe meeting, and what can attendees, if you like, expect?
So we've got a great topic on mental health and migration. And we're looking at mental health in terms of the impact of mental health. But we're also looking at migration and the impact of migration. We're asking ourselves as a community, are we missing something in migration? There are millions of people who migrated into Syria, into Turkey. Germany took in a lot of migrants. I think Angela Merkel will have the last laugh. Her economy is probably going to improve in 10 years' time because she's going to be leveraging on the skills of, that the Syrian community has brought on with them. Are these questions these are questions that perhaps we should be asking ourselves in the African continent? Can migration be a benefit? And if it can be, how can we leverage on that? So we have a guest from Turkey, psychiatrist Vasilita Senturk, very experienced in Turkey as well as in Africa, Agnes Gital, Kenyan economist, and a wide range of people who are coming in with interest.
And just to plug, it will be Wednesday the 6th of September. If you search Global Health Cafe on Twitter or any Eventbrite things, you'll find us. We're at the Health Foundry, which is just 2 minutes from Westminster Station.
Brilliant. Thank you very much indeed. Ade Adeyemi, who's a global health policy expert, and Dorcas Guata, who's the London-based global mental health expert. And together they formed Global Health Cafe. Thank you very much indeed.
Thank you.
Thanks for having us.